This presentation is on Article 7, Telephone Calls Make a Difference in Home Balance Training Outcomes, a randomized trial. Presenters today are Abby Isbell, Dylan Rains, Suzanne Sanders, Savannah Smith, and Taylor Steed. Falls are a significant problem in the older adult population, with severity of functional decline increasing with age. This leads to fear of falling and decreased mobility, as well as decreased independence. Falls resulted in $30 billion in healthcare costs in 2012, mostly from fractures, specifically hip fractures, head injuries, and anxiety. Despite this, funding for balance therapy has been decreased, even though the literature shows that balance and mobility programs have been proven to reduce the risk of falls in older adults. So how can we reduce cost and reduce the risk of falls? Home balance and mobility programs are one effective alternative to prevent falls and reduce cost. The problem is the adherence to these programs. One study showed only 37% participation of older adults who were prescribed exercise programs for balance deficits. So the objective of this study was to determine if a weekly phone call would improve adherence to a home exercise balance program.
This study was a randomized clinical trial. Participants were 75 frail community-dwelling adults aged 64 to 88 with a history of falling at least twice in the past 12 months. Eligibility criteria included that they were able to walk 20 feet and that they had a score of 24 or above on the mini mental state exam, which indicates normal cognition. The outcome measure used was the Berg Balance Scale, which assesses balance and is predictive of fall risk. Higher scores indicate greater balance control. Participants were randomly assigned via coin toss into either the no telephone call group or the telephone call group. After an initial evaluation, they were instructed on how to perform individualized home exercise programs based on the PT's findings. The participants returned to the clinic for monthly progress evaluations and to receive exercise progressions. In addition to these monthly visits, the telephone call group received weekly phone calls to address how they were doing with their exercises, inquire if they had any falls, and encourage them to continue their exercise program. After 12 weeks, the participants were evaluated by the same PT who was blinded to group assignment.
The control group, who did not receive a weekly phone call, improved their Berg scores by 3.9, and the experimental group, who did receive a weekly phone call, improved their Berg score by 6.9. The difference in Berg scores between the two groups had a p-value of 0.859, which is not statistically significant. However, there was a statistically significant difference in the rate of improvement of the Berg scores between the two groups, with a p-value of 0.038. This matters because it shows that the experimental group improved their balance scores faster than the control group, starting after the 4th week. The experimental group also continued to have improved balance scores after the 4th week, while the control group scores plateaued, as you can see in the chart.
An increase in balance control over time was noted in both groups, which indicates that an exercise plan can be effective for older adults who have fallen. An increase in performance could also be attributed to less face-to-face visits. The study suggests that older adults tend to get extremely fatigued with continual hospital visits, and the study showed that with only 4 face-to-face visits over 12 weeks, there still was a significant improvement in balance control. The main outcome measure used was the Berg Balance Scale, and the telephone call group had a significantly higher change than the non-telephone call group. It still wasn't considered clinically significant, but it still showed that that contact helped. And the study also suggests that this is due to a lower dropout rate among the telephone group. And overall, limitations in the study are gender diversity and then a lack of assessment of any cognition or pain or depression amongst the patients.
So, what are the takeaway messages from this article? Well, first, it's clear that skilled PT interventions can help prevent falls in the geriatric population. It is important that physical therapists tailor the program to meet the specific needs of the patient and not use a cookie cutter approach of using one protocol for every patient. Additionally, a weekly phone call can help keep the patient engaged with interventions, which in turn improves compliance and outcomes. Now, in specifics, what can we do with this knowledge? It is my personal opinion that the trend of improved outcomes with the use of a phone call can be adapted to the use of telehealth and physical therapy. According to the Mississippi Physical Therapy Practice Act, telehealth is an appropriate model of service delivery when it is provided in a manner consistent with the standards of practice, ethical principles, rules, and regulations for Mississippi physical therapy practitioners. The article mentions that the whole reason for the home exercise program and phone call was to make it easier for the patient to perform physical therapy interventions. Telehealth could accomplish the same goal, and it is billable. Now, regardless of whether telehealth is implemented or not, a phone call is much easier to perform, let's admit. A simple call to a patient has been shown to increase compliance and improve outcomes. While it isn't billable, it is one more tool in our toolbox that we can use to help better serve our patients.